Namaskar. Hello everyone. I am Dr. Gaurav Dash, consultant dermatologist in Cuttack, Odisha. I am here to make you aware about a very common condition, dandruff and seborrheic dermatitis. In simple term, as we all know, dandruff means those whitish scales, flakes coming out of the scalp. When it is associated with reddish rash, it is called seborrheic dermatitis. It can affect any age group ranging from small child to an older age group. It usually affects the scalp, but other areas like beard area, eyelid, chest, axilla and groin can also be affected. Usually patients come to us with complaints of whitish scales and flakes coming out of the scalp associated with itching in the scalp. Some people also come with complaints of reddish skin lesions associated with itching in the scalp. Most patients come to us with associated increased hair fall. Coming to the cause of this disease is still unknown, but it is being told that there is a fungus named Malassezia furfur which normally exists in our scalp, which becomes active under a certain condition, and they convert oil into free fatty acid, which is irritant to the scalp, which causes those reddish rash and scaling in the scalp. Other conditions like pollution, stress, decreased immunity can also aggravate this condition. Coming to the treatment of this disease can be very challenging because of this recurrence of this disease. It is one of the disease which can be controlled rather than cured. So continuous care of the hair and scalp is essential because hair is exposed to many harsh things daily like sunlight and pollutant. So few tips I would like to give it to take care of this dandruff. Regular washing of the scalp hair with shampoo is essential. Now which shampoo to use and how much to use and frequency of use depends can be best treated with a dermatologist and can be best decided by a dermatologist. It varies from patient to patient according to severity and cannot be told on a generalized basis. Few mistakes I like to point out which people do during shampooing. Daily shampooing of the hair is good for hair. That's what people think, but it is not good for hair because it causes drying of the hair, leading to fragile hair, leading to increased hair fall. So we usually recommend patient to take 2 to 3 episodes of shampooing per week. Now another mistake I'd like to point out which patient do while application of shampoo. We usually recommend them to apply shampoo over the scalp rather than hair because dandruff arises from the scalp rather than hair. So unnecessary application of the shampoo to the hair leads to decreased moisture from the hair, leading to drying of the hair and leading to damage to the hair. Many people try vigorous washing to get rid of the dandruff, but I recommend them to be gentle to the hair. I also recommend them never to use warm water for washing or hot water for washing. I always recommend them use to normal water or lukewarm water. Generally people are of the perception that oiling of the hair is good for dandruff, but that's not the case. I strictly tell my patients to avoid oil. Some people also come that they do not agree and they tell they cannot live without application of hair. We tell them to apply hair only couple of hours before washing, and oiling should be restricted to the hair rather than the hair roots and scalp. Nowadays many people are conscious about their skin but not their hair. While going outside, we recommend them to use protective like cap or any hat or umbrella, which will protect them from sunlight and pollutions. Some people do swimming. We also recommend them to use a swimming cap. To protect them from the harsh chlorinated water. Apart from all this, I usually recommend to my patients to maintain a balanced diet which is rich in iron, calcium and protein, like green leafy vegetables, fruits, salads, then egg whites and milk. Apart from all this, in this busy life schedule, I always tell my patients to keep some time for yoga, meditation, exercise to decrease the stress level, and they have also been seen to increase the blood flow to scalp, which is essential for good hair. Now, I always recommend them to avoid junk food. Regular sleep of around 6 to 8 hours and adequate hydration of around 3 to 4 liters is essential for great hair. Now, alcohol and smoking should be strictly avoided. Nowadays, many hairstyling procedures like ironing, dyeing, straightening, very popular among the youngsters. It may make you look good on the outside, but it damages the hair on the long run. So I do not tell them to avoid it. I always tell them to keep it to the minimum. Those who are suffering from this disease, I recommend them to follow these instructions for better control of dandruff. If there is still dandruff, you can always consult a nearby dermatologist. Lots of hair product and shampoo are available in the market over the counter, so I recommend you not to take it over the counter without consulting a dermatologist. I always recommend you to consult your nearby dermatologist for proper control of this dandruff. If you like this video, like, share and subscribe this video.